Hi, hello, this is RJ Shamli from Radio City 91.1 FM. And on this World Contraception Day, we are privileged to have Dr. Sharada Garu, gynecologist, obstetrician, and laparoscopic surgeon from Hyderabad. Ma'am, welcome to Radio City.
Thank you. Thank you, Shamli.
And yes, we have a few questions for you, ma'am.
Definitely.
Yeah.
Cheppandi.
Okay, the first question is, what is the birth control pill and how safe is birth control pill?
So birth control pill is a tablet. It's basically a medicine. It's a combination of two hormones. Our human body actually has some hormones, both in estrogen and progesterone. So a combination of that in a proper dose so that it prevents pregnancy. So the birth control pill is a medicine with combination of hormones to prevent pregnancy.
Okay, ma'am. And what are the benefits of this modern birth control pills? Will the birth control pill cause weight gain?
Yeah. So actually birth control pills are invented to prevent pregnancy, but they have a lot of additional helpful effects. Like many of them have acne on the face. So they take care of that acne. Unwanted hair, they take care of unwanted hair. Most of the girls do have severe pain. They can't go to their school, colleges or work because of the pain every month. By taking these pills, that pain is avoided. And most of them are anemic. They have heavy periods. So the pills do take care of that heavy periods. So they are all good effects of these pills. So modern pills definitely are very helpful.
Okay. So what is an IUD? What are the benefits of IUD? And are there any additional benefits of hormonal IUDs? Can you explain more about this hormonal IUDs?
So IUD means an intrauterine device. So we all know that a human female body has a uterus. Uterus is a place where a baby grows. So by putting a device into the uterus, the pregnancy is prevented. So then we call it an intrauterine device. So we have two forms of intrauterine devices, a hormonal one and a non-hormonal one. So the non-hormonal one has a metal in it. So that gives a bit of heavy periods. So even that prevents pregnancy, but it gives a bit heavy. The hormonal one has got, which we put it into the uterus, it decreases the blood flow. So the women can have very less periods, and it definitely, one thing, it prevents pregnancy. But more than pregnancy, it is used for decreasing the blood flow. So like, especially when the woman is reaching menopause and they have heavy periods, decreases their blood flow and prevents the need for hysterectomy. So many women don't have to get their uterus out for heavy periods.
Okay, ma'am. And there is a common myth, like oral pills, that they can cause infertility. Is it true?
Yes. No. They do not cause, it's definitely a myth. So infertility is not caused by oral contraceptives. The pill will act only for the month which when we take. The day we stop the pill, the next month the fertility is back to normal. So sometimes there can be a new problem like some new thyroid issues or some other factors or male factors which can cause infertility. Pills will not cause infertility.
Okay, ma'am. And what are some of the short terms and long terms methods of contraception?
Yes. So the short term methods we have, which we use for a small period of time, like in between the pregnancies or for a short time. So we can use the contraceptive pills, the hormonal pills. We can use short time the intrauterine devices. We can use an implants. And there are long term methods when we use more than 5 years. So more than around 5 years or 5 to 10 years. So like again the intrauterine devices. We can use the Mirena. We can use long-term copperties. So copperties can be used for 10 years. There are long terms which copperty which can be used for 10 years. They're all reversible methods. So once we remove them, the fertility is back to normal.
Okay, ma'am. How important is to have the pills regularly?
Yes. So the pill mechanism of action is if you take it continuously, then it suppresses our ovarian, the release of egg. But when you miss the pill, then that suppression is lost. So the main purpose of taking the pill is pregnancy has to be avoided. But when the pill is missed, that contraception action of the whole month is lost. So the pill has to be taken very regularly.
So last question is like, what message would you like to give the listeners on birth control?
So the modern women has changed their thought process in many ways. They have become financially independent, professionally well ahead of the male counterparts. They are like much planned. But the myths about birth control is definitely still there among most of us, which has to be overcome. We should know really the facts, what birth control is, and the methods of birth control, and plan the pregnancy properly, and not end up in unplanned pregnancies.
Okay, ma'am. Thank you so much.
Thank you.
Bye.